Good afternoon. I'm Edith Parker. I'm the Dean of the College of Public Health, and I wanted to welcome you to our College of Public Health Outstanding Alumni Awards. Before we get started, I have a few technical items to mention. One, we will be recording this event. And second, there will be time for questions at the end, and you can ask a question by using the Q&A feature at the bottom of your screen. Each year, the College of Public Health recognizes alumni for distinguished contributions to their chosen fields within public health. Through the Outstanding Alumni Awards, we're delighted to recognize these remarkable individuals for their professional accomplishments and for their dedication to the ideals of our college. This year, we acknowledge two such individuals. In the recent graduate category, we're pleased to honor Kari Harland, who received her Master of Public Health degree in Epidemiology in 2004 and a doctoral degree in Epidemiology in 2010. She is currently Director of Research Operations in the Department of Emergency Medicine at the University of Iowa Carver College of Medicine and an adjunct assistant professor within the Department of Epidemiology here at our college. She was additionally trained in the Department of Occupational and Environmental Health's Heartland Center for Occupational and Health Safety as an Occupational Injury Prevention Fellow. As a supervisor and mentor to medical students, medical residents, and graduate students, she teaches analytic approaches and methodologies connecting classroom learning to real-world work. In 2018, she received the University of Iowa Supervisor of the Year Award. She currently manages over 30 active research projects in the UIHC Emergency Medicine Department. Her strategic vision and ability to build a cohesive team has helped rapidly expand the department's research capabilities, increasing its annual productivity by 350% over the last 5 years. Her research focuses on improvement of rural health, intimate partner violence, sexual assault prevention, and education and mental health interventions for youth. She has published over 70 peer-reviewed papers and served as the principal or co-investigator for several NIH or CDC-funded grants. She's a core faculty member of the UI Injury Prevention Research Center and serves as evaluator for the CDC-funded Rape Prevention Education Program housed at the Iowa Department of Public Health. We're certainly very proud to recognize Kari today and to acknowledge her as one of our college's most outstanding alumni. And I'm going to invite Kari to say a few words now.
Thank you, Dr. Parker. I would like to start by saying thank you for this award. I'm honored to be among the many individuals who have represented our college so well. I'd like to thank those who nominated me, which include 2 graduate students in epidemiology, Priyanka Vakalanka and Morgan Bob Swanson, as well as Dr. Karen Pikesa and Dr. Moore in the Department of Emergency Medicine. Without that team, I wouldn't be where I am today. We were asked to speak today a little bit about our career path and how we got to where we are and what we're currently working on. And I think my path might be different than many others. I was an undergraduate at the University of Iowa, and I had absolutely no idea what epidemiology was. I knew that I thought of public health as vaccinations, which is really important in our current public health environment. But as an Iowa farm girl, I heard about a project in the Department of Epidemiology, working for Dr. Lynch in the Agricultural Health Study, where you interviewed farmers. And I thought, well, my dad's a farmer. I grew up in a farm community. That's something I could do. And through that experience, I learned to fall in love with epidemiology. I got to speak with farmers about many of the things that affect their health, the pesticides they use, the hours that they work. And that first experience in that project really is what helped me to fall in love with epidemiology. During that time working there, I interviewed farmers. I mailed samples so that we could collect biological samples from these participants. And I had great mentors there. Ms. Nyla Logston-Sackett was the coordinator of this project, and I watched how she worked and learned from her and spoke with her about the possibility of going back to school for public health. And I also talked with Dr. Bill Field, which many of you might know over in occupational environmental health. And Bill's response was, go for it, why not? And so with his encouragement, I went ahead and applied and got my master's of public health. And at the same time, I applied for a position with Dr. Audrey Saflis in the Department of Epidemiology, working on 2 NIH-funded projects that she had. One in intimate partner violence, which is near and dear to my heart and an area that I'm very interested in, and one working on pregnancy health. And so through these projects with Dr. Saflis, I was able to actually apply everything I learned in the classroom, which I think for students is probably one of the most important things I can say today. I helped develop these studies, their interview projects. I helped figure out how to do the data collection and the chart reviews and every aspect of those studies. And the one thing I learned that I'd like to really send out to the students that are here today is often we think of the analysis part being the cool part and the really important part, but really data collection and making sure we collect that data well is the most important part of our research. So if you get an opportunity to help with data collection, help develop that data collection, and really, really stress that you help with that part. And after, I worked on these projects with Dr. Saflis and they were coming to an end. And that's when I had the opportunity to start working with Dr. Karen Pikesa in the Injury Prevention Research Center. And I was able to do the Occupational Injury Fellowship that Dr. Parker had spoke about. This injury fellowship allowed me to marry 2 things I'm very passionate about, which is injury prevention, injury and violence prevention, and also occupation. As we're learning more and more, we spend so much time working that it's important that we study how that affects our health. And through that fellowship, I was able to get additional training in both of these areas, which really helped to set me up to be able to be competitive in the job market. So when I graduated from that position, I actually had a split position between the Injury Prevention Research Center and the Department of Emergency Medicine, where I now work in the Carver College of Medicine. And in that position, I learned to love working with clinicians and applying that sort of side of clinical epidemiology. If you would have asked me when I started getting my degree, I would have told you I probably would never work in clinical epidemiology. But one thing I would say that I love most about the program at the University of Iowa in epidemiology is literally the skills you learn there, you can apply to any topic, anytime. And during my time with the Injury Center and in emergency medicine, I became even more passionate about intimate partner violence and the prevention of it. And so at that time, we went to thinking more upstream, and I was given an opportunity by the Injury Prevention Research Center to submit a grant as part of their competitive renewal, looking at a teen dating violence public health law prevention evaluation, which we are currently finishing up. And what this project allows is for, we're looking at what's required at state level education for teen dating violence prevention and marrying that to the Youth Risk Behavior Survey. So trying to examine the effectiveness of these laws on teen dating violence prevention. And in that role also, as Dr. Parker had mentioned, I was able to work with the rape prevention education program throughout our state. So our state receives funding from the CDC, where we go out into schools and teach education and prevention of sexual violence. And one thing I've continually heard from those working on the ground in this is these things that individuals such as myself develop in academia are really hard for them to apply in the community. And so the next project we'll be working on with Injury Prevention Research Center is a translation project of an evidence-based program into communities to see how what we develop in a community, or excuse me, in academia can actually apply to the community. The last thing I want to talk about real quickly is a project that I'm working on. Like I said, I didn't think I'd ever do clinical epidemiology, and I definitely didn't ever think I'd work in infectious disease epidemiology, but welcome COVID. We're currently working in the Department of Emergency Medicine on a prospective cohort study, an occupational prospective cohort study. So the same sort of project that I worked on when I first began in the world of epidemiology, and we're looking at risk factors for COVID among those working in emergency departments. So in brief conclusion, I really feel like the program at the University of Iowa College of Public Health developed me to be able to, as you can see, help run, analyze a gamut of different projects in a million different topic areas. And so I'm really grateful to all the faculty I've worked with, the mentors I've had, particularly Dr. Kesa, Dr. Saflis, Dr. Moore, who have been instrumental in the development of my career. And of course, I'd like to thank my family, my husband, my kids, my mom and dad, my in-laws, all of those who have stepped up to make sure that our family is successful in support of my career. Thank you.
Thank you so much, Kari. Next, I would like to, in the Career Achievement category, we're pleased to honor Ty Borders, who received a Master's of Arts degree in Hospital and Health Administration in 1995, a doctoral degree in Hospital and Health Administration in 1999, and a Master of Science degree in Epidemiology in 2001. He is currently a professor in the College of Nursing and director of the Rural and Underserved Health Research Center at the University of Kentucky. Ty is a nationally recognized leader in the field of rural health and has served as editor of the Journal of Rural Health for the past 11 years. He was appointed to the National Advisory Committee on Rural Health and Human Services, which advises the U.S. Secretary of Health and Human Services. His research contributions to substance abuse issues in rural areas have helped to shape rural health policy. He has served as principal investigator on many grants and published numerous high-impact peer-reviewed articles focused on rural, urban, racial, and ethnic variations in health-related quality of life, consumer reports of care, and healthcare access. His honors include being elected as a Fellow of the American College of Epidemiology, receiving the Excellence in Writing Award from the University of Kentucky Department of Writing, Rhetoric, and Digital Studies, and being appointed a colonial in the Commonwealth of Kentucky, an honor bestowed by the Governor of Kentucky in recognition of outstanding service to the community, state, and nation. He has been an outstanding teacher and mentor, including being nominated for Teacher of the Year. We're very pleased to recognize Ty today and to acknowledge him as one of our college's most outstanding alumni. And I'll ask Ty to say a few words.
Hello, thank you for that nice introduction, Dean Parker. And let me extend my congratulations to Kari also for her award. I want to begin by thanking the two persons who nominated me. This would be Betsy Chrysilis, a professor in epidemiology, and also Mary Charlton, an associate professor in epi. Betsy was my professor when I was a student at Iowa, and I've gotten to know Mary a bit in her role as a member of the editorial board for the Journal of Rural Health. I'm very honored to receive this award today, and I owe a great deal of gratitude to the faculty in health administration, the faculty in epidemiology, and others in the College of Public Health at Iowa. And it really is this combined education that I received in epidemiology as well as health administration that prepared me for my career as a successful health services researcher. I've long been interested in rural health and healthcare. I suppose this dates back to my upbringing in rural Kansas, but it's really my career in rural health research that began at the University of Iowa. When I was a master's student in health administration, I worked on some research projects with Peter Helsenrath, Doug Wakefield, and Mike Hendricks, who were formerly professors at Iowa. And I also took a course, an advanced course in epidemiology from Betsy Chrysilis, Jim Turner, and Bob Wallace that made me really start to think more about potentially going into academia. After about a year in the rural world, you might say, at Blue Cross and Blue Shield of Iowa, I decided to return to the university and pursue my PhD in health administration with a minor in epidemiology. And I guess I took so many extra courses in epi that I actually ended up doing an extra thesis and receiving a master's of science in epi. So while I was at Iowa pursuing my PhD, I worked with many of the same faculty members as before, but I also had the opportunity to work with Jim Rohr, who was my mentor and advisor for my dissertation. I accompanied Jim to the Texas Tech Health Science Center when I graduated, and helped him start a new Department of Health Services research there, which was really beneficial to my career. I was involved in the conduct of 2 large population-based studies. One, a survey of about 5,000 older persons about their health and healthcare, and one, a survey of about 6,000 parents about their children's health and healthcare access. However, I decided I wanted to really take a shot at pursuing NIH funding. And this sort of drew me to the University of Arkansas for Medical Sciences. I had thought about doing a postdoctoral fellowship at UAMS when I was graduating from Iowa under the tutelage of Brenda Booth, who happens to be an Iowa alumni and someone who received this very same award a few years ago. So when a position opened up there in public health, I reached out to Brenda. And one of the main reasons again, I moved to UAMS was to work with her under her mentorship and really focus my career on rural addiction health services research. She was very instrumental in building out my career in this area. I worked with her on some of her studies, writing papers and so forth. And she sort of showed me the ropes for applying for grants, and I was successful in getting funding as PI from the NIH. So UAMS was also very beneficial to my career, but I kind of longed to be back at a real university or a big university campus instead of a health science center where I'd spent most of my career. I kind of missed just walking across campus and going to basketball and football and so forth, like persons can do at Iowa. And I was recruited to the University of Kentucky by another colleague who actually was my department chair at UAMS, Glenn Mays, to be his department chair here of health management and policy. At Kentucky, I've continued to do work in the area of rural health research and policy with a focus on addiction. And as part of our federally funded Rural Health Research Center, I've expanded my work to include research on rural mental health services access, as well as more recently, rural cancer treatment access. I can't really claim the same type of Iowa connection here at Kentucky as I've had at other universities, although I will point out that Mark Stoops, who is the football coach who played at Iowa under Hayden Fry, lives in our neighborhood, although in the much more expensive part of the neighborhood. Of course, I also need to thank my parents and my sister for supporting my academic ambitions, and my wife and my children, my daughter Harper and George. Hopefully we'll be able to watch this later in between playing Fortnite and practicing gymnastics. But they have really dealt with my stress and so forth over the years in terms of applying for grants and other things that we do in academia. So in summary, let me just reiterate that much of my success is really because of what I learned at Iowa and the connections I made at Iowa. And I just want to thank persons again for receiving this very prestigious award.
Thank you so much, Ty. Now we're going to continue with a panel discussion with our award recipients, and I'd like to turn it over to 2 of our students who will be the moderators. Steve Saunier is an MPH student in health management and policy, and Emma Metter is a public health undergraduate student. So Steve and Emma, please take it away.
Thank you, Dean Parker.
Yeah, thank you very much for that nice introduction. To start off, could you each talk a little bit about your time as a student? What advice do you have for today's students?
We didn't talk about who would go first, so I'll take this one first. I think some of the things I talked about earlier, I think for today's student, it's really important when you come into the job market, the expectation is that you will have applied those skills that you learn in the classroom. And so I think that's one big takeaway. And the other is to build your mentorship team to be what you want your career to be. So if academia is not what you want, then that's, find mentors outside of academia. If you think you want to have a family, have mentors that have a family, all of those sort of things. I think those are the two big take homes that I would have for students today.
Yeah, I think my comments would be similar. When I think about students I've worked with who have graduated recently and been successful in pursuing careers, whether those are in research or academia or the private sector, I think that what's really important is that persons have skills, because I think employers are looking for graduates who are good writers, who have strong analytical skills. Those may be quantitative or statistical oriented, or they could be analytically oriented in terms of thinking about complex problems. But to the extent that persons have skills and they have experience with those skills, I think that really is what sets persons apart. And that's what I look for in my own work when I'm thinking about hiring somebody to be part of our team.
And Ty, continuing on that thread of skills needed, what made you want to pursue that master's in epidemiology after you got your master's and doctoral degrees in hospital and health administration? Was there something that stuck out to you that made you think, I need epidemiology to succeed in this area or define myself further?
So usually when a person receives or pursues a PhD in health administration, or really at that level, it's health services research, a person would minor or sort of concentrate in economics, health economics, or epidemiology or organizational behavior. So I decided to have my methods concentration in epidemiology. And then I learned a lot about the substance of health management and policy from my courses in health administration. But I think that having just the added method skills, and I took more courses than I needed to graduate. I forget how many hours I had, but it was like 20 or 30 hours more than I needed to get my doctorate. I decided, why not just go ahead and tack on the MS? But I think this combination of skills is beneficial. If individuals can bring together skills from different areas, I think it helps to set them apart.
Then going on to our next question, how did you find out about finding your first job? Many students here will be going through that process this year or next year. Do you have any suggestions for them to make that process easier or more robust?
Ty, you can go first this time.
I'll take this one. Well, my first, I guess, job, a real career type position was when after we got my master's degree in health administration and worked in Des Moines at Blue Cross and Blue Shield of Iowa for their consulting division. And, Iowa has always had really strong alumni connections and networks, which is a real benefit to graduates of the programs. And as I spoke about during my brief words, clearly a lot of the positions I've taken over the years and the positions I've been offered are really because of the connections I've built up in the field. Some of them through contacts and connections to other Iowa alumni, but also in terms of just getting to know people in the field. And I suppose that's something that persons in any area might say is, continue to try to get to know people and so forth.
I would echo those words as well. And I have found it'll be a little bit different in the next couple of years, but also reach out to those people who are experts in the field and ask to meet with them at conferences. It's been amazing to me how many of the big names that in your field would love to have breakfast with you and talk with you about your future plans. And so it can feel like a big risk, but I think it's one that's definitely worth taking to reach out to those people.
Yeah, that's a good point. I tell my students all the time that I'm happy they come to my office. I think people are sort of scared to come to my office for some reason. Maybe they just think I'm too busy but people are generally pretty happy to talk with others. And don't be shy about reaching out or, emailing somebody or giving that person a call.
And in addition to that opportunity to reach out and talk to further connections, when you're talking about finding your first job or your second job, aside from the connections piece, what did each of you do to position yourselves to be successful in the workforce? What were kind of the do's and don'ts of building up your career initially?
Well, I don't want to cut Kari off.
No, go ahead. I'm still processing.
Academia is not necessarily how it works in other sectors. But in academia, I think one of the things I did was I began by doing analyses, publishing many papers to try to get my work out in publication. And I think that's important before people start applying for grants. And in medicine and public health and pharmacy, nursing, many of the health related fields, we're applying for grants. And so that's very important too. So you need to build up your skills in terms of writing and also analysis and being successful in getting grant funding to be in many fields in academia. Now that's not necessarily the case, I wouldn't think, for persons that may go into the private sector or may go work for a health department or so forth. Some of my students in the past few years have gone on to work for the federal government and sort of research related positions or health policy positions. And I think that what they have found that has been important is to really stay up to date on what the current issues are in health management and policy, and just to be, I guess, very well versed on those issues.
And I think from my standpoint, what I was able to do that set me apart, particularly between when I was getting my master's degree, is actually coordinating research studies. So I was actively, developing questionnaires, writing manuals of procedures, a lot of those things that will apply in a lot of different workspaces. It wasn't until I got my PhD was I able to do more of those analysis sort of things. But I think a lot of what we learned in data collection, like once you're good at analysis, it makes data collection easier because you think about it, how you're going to analyze that data later. And so I think, again, it's more that practical experience that you can get writing papers, like Ty was saying, that really can set you apart.
Yeah, it seems like it's definitely a big part of that initiative is wanting to have a strong foundation coming to any of the roles or any job that you're going to be experiencing. And then also, as a heads up too for our viewers, you're also welcome to submit any questions that you have using our question and answer tab. And then in our next segment, Kerry and Ty will be able to answer them for y'all. Emma, do you want to ask the next one?
So going off about what we just talked about building up your career, for the both of you, has there been a really big moment in your career in which you could go in one direction or the other? And if so, how did you decide how to proceed?
So I'll go first this time. So I spoke to it briefly in my comments, but there was a point after I graduated where I was working with the Injury Center at the College of Public Health 3 days a week, and then emergency medicine 2 days a week. And the injury prevention people are my people. That's my passionate area. But I decided to take, and it took a lot of thought and decision making to think about what I wanted for my career. And that's when I decided to move over to emergency medicine. It was at that time, there was one other research staff person in the whole department, Dr. Doreen Denning, and she mentored me on some of those clinical things that I hadn't experienced in some of my training. And it was the reason I made that decision is I saw opportunity for growth. I knew at the Injury Center I would be able to publish papers and I would be able to help manage studies, but at emergency medicine, I thought there was an opportunity to build a research infrastructure, which I've been able to do with Dr. Moore. We now have 24/7 research coverage in our emergency department. We have a whole 3 analysts, including some graduate research assistants. We have 2 research coordinators, and all of that's happened in the last 10 years. And it's something I'm really proud to have been a part of. Emergency medicine as an academic field is fairly new. Our department's, I'm going to say like 15 years old, maybe, which is not very old in the grand scheme of things. So for me, that big decision was, what did I want for my career and did I want to be part of building something new? Again, it's about taking a risk that might seem scary, but so far, so good.
So yes, I agree with Kerry that sometimes you have to kind of just take a chance or take a risk. And for me in academia, as a health services researcher, many of us are more interested in more general healthcare access and quality issues, but a lot of the funding is more condition or disease specific. So I decided really to dive into the area of addiction health services research to try to compete for funding from the National Institute of Drug Abuse and the National Institute of Alcohol Abuse. And that was, I think, a pretty pivotal moment for me to really take a shot at getting NIH funding. But also, over the years, I went to Texas Tech, to help start a new department out in in West Texas, and it's pretty far out there. I didn't even know where Lubbock, Texas was until I looked on the map. So that was a little risky. Although I met my wife there, who went to law school at Texas Tech, and then I went to UAMS, and now I'm at Kentucky. So I think that sometimes you kind of have to move around in academia, and unfortunately that means you may have to move to a different university to have a new experience or a new opportunity. Recently, as Dean Parker mentioned, I transferred to the College of Nursing here at Kentucky after being in public health for maybe 15 years. But having a little bit of a change of pace and work more with clinically oriented faculty members, and open up some other doors in terms of doing research with the Markey Cancer Center here at UK. So I guess the thing I would mention again is, take a chance. It's a little probably easier to do if you're not in academia. If somebody is an attorney or works in banking, a person can maybe go across town or across the street to a different place to work. But I think, I have one colleague, Glenn Mays, I don't think he would mind if I shared this. He sort of has in his mind that persons should move every 7 years or so just to have a different experience. So, I think it's important to kind of take a risk once in a while.
I think that's an incredibly valuable message, because I think a lot of folks end up in public health, but they don't expect to be doing what they're doing along the way. And it's kind of a very common thread to see all walks of life come together here. When you're talking about opening these doors or pulling on these different threads and seeing when they're leading, how did you guys decide to focus on your areas of research, whether it's rural health or injury prevention? What was kind of the thread that you pulled on to see where you should focus your interests?
Well, for my research, a lot of my work does involve the conduct of population-based surveys. I'm really interested in the consumer perspective and the patient perspective of health and healthcare access. This probably dates back even farther to my undergraduate days as a psychology student at the University of Kansas. But I'm really interested again in individuals' perceptions and behaviors. So I kind of just applied that to rural health, and I think in part because I went to Iowa and there were persons, faculty members there working in the area of rural health research, and then in part because of where I went when I graduated from Iowa to Texas Tech and then to Arkansas, and now here at Kentucky. These are places where rural health problems are more substantial than in some other areas of the U.S. So I think it's sort of a mixture of my interests, but also it's been affected by where I've worked and who I've been able to work with. You can't plan everything out, I suppose. It just sometimes it kind of just happens. Yeah.
It's interesting though that I did not know this, but Ty and I both have undergrads in psychology. So it's a good place to start. My area of focus, like I said, is intimate partner violence, gender violence. It really comes from my belief that what happens in our homes really has an effect on who we, the opportunities we get and the privilege that we have. I have personally been affected with family members who have experienced this sort of violence, and I have seen how it can change people and how strong it can make people. Like I said, a lot of the work that I did early on was more in identifying risk factors and interventions for people experiencing this type of violence. But really in the last 5 years or so, I'm trying to take that public health model and move up the rung to kind of that primary prevention. And so I think, and Ty has alluded to this, like it's really important that you have something you're passionate about. But at times you will work on things that you might not be as passionate about, but that are really important because that's where the funding is. And so it's really important to have those skills that can apply across these different topics. I mean, I remember when Dr. Moore called me about the covered COVID project that we're doing, and my response was, I know really nothing about infectious diseases, but I'm passionate about helping the people I work with. And so I think it's really important to have, people that you work with that you're passionate about, as well as a topic, an interest area that you're passionate about.
So throughout your career, from your time as a student to where you are now, how valuable has mentorship been to you?
So as I mentioned earlier, it has been very important. I kind of think about different persons who have served as mentors. I mentioned my colleague and friend, Peter Hilsenrath, who I've bounced ideas off of, and he's kind of mentored me in terms of thinking about, positions I've considered over the years. And then I mentioned Brenda Booth, who was very instrumental in really helping me get into the field of addiction health services research and engaging me in her projects, giving me the opportunity to work with her and publish from her data and so forth. So it has been really important. Today, I still call people and say, hey, what do you think about this? You think this is a good idea, or this is kind of a crazy idea? And it still plays, it's a little different now. I think my mentorship is more in terms of colleagues, but you need somebody who can really kind of reflect on what you're thinking.
Yep, I agree wholeheartedly. I think I mentioned, my first mentor, who I haven't had a lot of connection with over the years, but Dr. Bill Field was the one who said, give it a shot. Dr. Audrey Saflis and Corinne Picasa, as well as Ann Wallace, were really instrumental during my graduate degree, not just from training me in epidemiology and data collection, but also in work-life management and those sort of things. It's really important to have mentors who are willing to give you critical feedback and push you to be the best that you can be. Sometimes others can see in you what you can't see in yourself. And sometimes you just have to believe them when they tell you that you're capable of some things. And so I think as a woman in science, it's really important to have other women in science as your mentors, as well as have mentors that are, hashtag he for she, right? So they understand some of the challenges that come to us as women in science. They're willing to advocate for us. But mentorship, as you can tell, is really important, obviously.
Yeah, I think that you hit on all those, both of you hit on all those key points, that a mentor gives you that critical feedback, that they are there to understand your academic life, but then also your personal life. And at the end of the day, you want that integration there, because then you can understand how to be successful. And I really enjoyed the idea of, they can see what in you that you haven't been able to see yet, or what you can see being your potential and wanting to that be realized. Within this context of, everything that you've been able to accomplish so far on both of your ends, what has been the highlight of your career thus far, and why is that the highlight of your career? If Ty, you want to start us out with that question.
That's kind of a tough question. I kind of think about, well, here's one of them, right? Receiving this award, because we don't receive a lot of feedback in academia, at least very immediate feedback. But certainly when I ended up being successful in getting NIH funding, that was a pretty pivotal moment for me. I've also, as Dean Parker mentioned, been editor of the Journal of Rural Health for, 11 years, and that's been very beneficial for my career in terms of giving me more recognition in the field, but also forcing me to understand the field of rural health research and policy. So I kind of think about those really big events in terms of when I've done something that's been pretty hard, in terms of like getting a grant, successfully being chosen as editor and so forth.
I think for me, the thing that I'm most proud of, besides this award, as Ty said, would be the work that I'm doing with the Iowa Department of Public Health in the sexual violence prevention. it's really important to me that we try to translate what we're learning in academia to the community. It's also by far the hardest thing I've ever done, trying to measure things outside of a research infrastructure, doing true program evaluation, where I've learned so much from graduate students, even in our own college, who have expertise that I don't. But I really think trying to make that community impact in the realm of gendered violence and sexual violence is probably what I'm most proud of.
The other thing I might add is, maybe I was going to throw this in for a question later, but the other thing that I think is really fulfilling is, for me, is teaching. I spend most of my time these days doing research, but I like teaching students, undergraduates as well as graduate students, because when I see that a student gets it, it's rewarding for me. I figure, well, I must understand what I'm doing, and maybe I have a small impact on the way a student may think about things. Or if I'm walking across campus and somebody says, "Hey, Dr. Borders," I mean, that to me really matters, because I may write an article and so forth, and some people may read it or cite it, but it's not as, I guess, it's not the same impact as I think I have sometimes in terms of teaching.
Yeah, it's really phenomenal to have those touchstones throughout the interaction of talking with folks, especially in the mentorship side of things, like both of you have played in your roles, teaching students and encouraging their professional and personal growth along the way. And we do want to thank you for your contributions to Iowa, and then also congratulate you on receiving this excellent award. We'd like to turn it over to our Q&A now. We've got a couple questions along the way. And Emma, if you want to lead off with our first question from the audience.
Yes, so our first question from the audience is, do you have examples when perseverance played a critical role in your career success? Carrie, do you want to start?
Go ahead.
I think perseverance is probably the #1 characteristic that someone in academics has to have. And I think, gosh, I'm trying to think of a specific example. I guess the biggest one would be, applying for that grant again, or in the current cohort study we're doing, we got that cohort study up in about 4 weeks, from the notice of funding to recruiting 1,600 physicians, nurses across the US. And perseverance is what did it, and not just my own, but the team's perseverance, that we were going to do this. This had to be done now because COVID is now, and we want to support those who are taking care of those. But I really think, perseverance is by far, I think, the best characteristic that maybe someone in academia can have.
Yeah, so the example I was thinking of, and maybe it's because I'm working on a grant application right now, when I was at UAMS, I submitted an R01, and this is when we could submit applications 3 times. So the first reviews that other professors provided, they were good, but I didn't get a score. So you want to get a score on these things. We reapplied. The second time we got a pretty good score, but it wasn't funded. So, a little disappointing, I suppose. But then on the final stage, final application, we actually got a perfect score somehow. So I'm like, you have to keep trying. You can't just give up. And unfortunately, in academia, some of these things take months or years. So you really have to kind of stick with it.
And within that thread of things, you're talking about perseverance and having to reapply or doing things as a team. You both have indicated how versatile epidemiology is and the importance of teams overall. What is it that you want to focus on with balancing teams out? When you're coming together and bringing together different skill sets, what are things that students should be thinking of in that interprofessional environment?
So I work with people from many different areas, and especially with our Rural Health Research Center, I have colleagues who are from political science, epidemiology, bioinformatics, communication and journalism, public health, medicine, and people have different knowledge and also different skills. And I I'm the first one to acknowledge I have some skills, and there are some skills that other people have that I don't. And, people who are graduating, now know things that I don't know too. So we're really dealing with complex issues, and it's important to work in teams, but I also think it's intellectually challenging. To really pull this off, though, I think it also requires that persons have an understanding, at least some understanding of different disciplines in the language. Sometimes we're studying we're trying to address the same things, but maybe doing it in a slightly different way or with different language. I'm thinking about people I work with in economics that are trying to address the same types of things as epidemiologists, but they're using different techniques and different languages. So I think it's important, and students in public health like Stevlin and Emma and others are I'm sure, getting a really good education in this, is that you do have an understanding of health behavior, biostats, health management and policy, et cetera, so that you can successfully communicate with others.
Yeah, I would think when I think about balancing a team, I think about what the project involves and who when that project comes to an end, who is going to be my end user of that research project, and what sort of information am I going to need to communicate that to participants. I think a lot of, in public health, we're realizing we don't maybe communicate as well as we should. But I think in developing the team, I think about what skills people have, but I also think it's really important to make sure that we add diversity to our teams. Just as Ty was talking, not only discipline, but focusing on pulling in people that we haven't worked with before across different colleges, different universities. As Ty has spoken before, I think one of my favorite things about working with students is I'm always learning from them also. Because as he said, there's, epidemiology is changing every day. And so I think in building that team, I want to, have someone who knows more than I do always on some sort of other topics for whatever that end user product's going to be.
Great, thank you. I think those are wonderful points you both brought up. And based on the last 6 months, how do you think that the current events are playing into your research? How do you think it may change your research? And specifically, has your research changed faced with rural public and rural emergency systems? So just kind of how has everything that's been going on, all the current events, just kind of changed your research and teaching?
Well, when COVID-19 really started to take off in the US, I started to get some calls from media about how is this affecting rural areas, and I, like most people, didn't have many answers because it was so new. And I spent a lot of time trying to really read up on what we did know about this issue and potential treatments and how it may be affecting the healthcare system. And of course, because last semester I was teaching a class on healthcare organization and policy for undergraduate students, and I quickly added a session on COVID-19. But there's just so much that we don't know. We're learning more, but there's a lot that we don't know. I think it's important, though, that we try to change our research and teaching pretty rapidly to respond to this crisis. And as an example, I submitted a grant proposal in May. Actually, I submitted several grant proposals in May, either as the PI or a co-I with some other colleagues, to try to get more information about how COVID is affecting the healthcare system, including primary care physicians, family physicians, as well as some more specific topics like how are primary care physicians being able to treat persons with opioid disorder via telehealth. So COVID has really forced all these changes in the healthcare system, such as this relaxation of these regulations pertaining to telehealth, which I think could have some really long-lasting positive effects in terms of improving access. So we just need more information, but it's important in public health in general to really, I think, address topics that are of a timely nature.
So I spoke a little bit already about Project Covered, which is a project that we have in the emergency department looking at the risk to emergency physicians. And although I found that work really fulfilling, I think what COVID-19 has given to me is even more energy to understand societal inequities, particularly gender inequities. We see that women who are working from home, having to balance, even though I don't like to use the word work-life balance, but even more the sort of inequities and how this pandemic may affect women's careers differentially than it has some of our male colleagues. And so I think it's just even made me more passionate about learning more about gender inequities, how kids being at home has affected the violence that those children are seeing, and everyone being in the home, things that we currently don't understand. But with kids, not being in school, not being with mandatory reporters and those sort of things, it really has made me just more passionate about what I already cared about.
And I think that's one of the silver linings out of the pandemic, right? We are finding out these really intricate areas that we are all wanting to explore further and seeing potential, and then areas of concern too that are evolving with that. We are seeing an unprecedented situation on our hands that we can devote our public health interest to for current students and then for current career professionals as well to this. One of the last points that we want to touch on today too is, we've talked a lot about different skills along the way. And one of the things outside of the academic setting is the soft skills. And the thing that we want to touch on really quick is, what are some soft skills that you would encourage students to develop that will help in their success beyond their education?
So one thing that comes to mind, I guess this is sort of a soft skill, is being able to convey your work and what you do succinctly to others who are not in these rather specific fields that we sometimes get into. As an example, I've had the opportunity to travel with our university's federal liaison to DC a couple of times to meet with our congressional delegation staff persons. And typically I have like 5 minutes tops to tell them our story and what we're doing for Kentucky, and kind of put in an ask for what they can maybe try to do to help out the university to continue our work. And this takes, so you have to be a good communicator, you have to do it quickly. You also have to be sure that you kind of put politics aside, because you're not there for political reasons, you're there for the university. And I think persons can think about this in terms of their own positions in the private sector or government, et cetera. Being able to communicate effectively, but also to represent your organization in a way that helps the organization out, if that makes sense.
And I think the soft skill, the two that kind of come to mind is developing your emotional intelligence, as well as understanding who your staff are and the type of feedback that they need, or the students that you're working with, those that you're mentoring. One of my strengths is not being a direct communicator. I'm a Midwestern girl. And so, but there are people who, respond better to more direct communication. And sometimes my ways of communication, right, are confusing. So, developing those sort of soft skills to know how to work with the people you're mentoring, your staff, your emotional intelligence to be able to understand without maybe any words being said if someone is experiencing something that maybe they don't even want to talk about, but giving them the space, the safe space to be able to discuss those things. So
yeah, I think that's a good important emphasis, is saying more with less, tailoring your audience accordingly, making sure that you are recognizing where people are at. I think those are really common themes that we see in public health, and it is a continual thing to want to improve our communication skills. I do want to thank you both for coming on today and chatting with us more and hearing about all of your answers to our various questions. And I'd like to turn it over to Dean Parker to deliver our closing remarks.
Thank you.
Well, thank you all. Thank you particularly to our Ty and Kara. And also, I think Steve and Emma, you did a fantastic job with that. So I really thank you for your time and efforts today. And for everyone else, it's good to be together again, and look forward to seeing you in our next event. And again, congratulations to Ty and Kerry again on the very well-deserved honor. Everybody have a good afternoon.
Thank you very much.
Thank you.
Bye.